further ado, I'll hand it over to you.
Thank you, Jitendra, and I think the technology fails us sometimes, but I think Jitendra, you will have the video available in our Twitter accounts and LinkedIn accounts and our website as well.
Yes, that's right.
Okay, sounds good. So
it's a beautiful video, by the way. I saw it before the meeting.
Okay, so I encourage everybody to see it, and when Jitendra puts it on the Twitter account. I haven't seen it actually, but it's thank you, Jitendra, for the attempt, and it's a pleasure to connect with everybody here. I see the attendees, the number of attendees is rising, and let me first thank Dr. Walid Adas for agreeing to moderate this webinar despite the short notice. Dr. Sami Al-Suwailim couldn't join us because of other engagements, but he conveyed his regards to everybody within this task force. A special thanks also goes to our co-chairs who are helping in organizing, not only organizing this webinar, but also contributed to the task force content over the last few months. And I'm glad and happy and honored to have Khalid, Dr. Khalid Al-Abdel Karim joining us to give opening remark after my note, coming from or representing the healthcare working group. Let me first, before I give the mic to Khalid Al-Abdel Karim, highlight a number of areas where I think are relevant to this task force and relevant to the T20 work so far and moving forward as well. But before doing that, I would like to first note that the COVID-19 pandemic is above all a human tragedy and perhaps the most significant civilizational threat that we have faced in our lifetime. The COVID-19 has by now spread to more than 4 million people in over 180 countries, a rate of infection that has never been seen in more than a century. Such impact or such a spread or the rapid spread and impact on has a significant impact on our healthcare system, society, the market, and the economy. And as we observed, even very strong and well-funded healthcare systems are facing difficulties coping up with the pandemic. The socio-economic impact of this pandemic are very clear. Global economic growth are turning negative, and the IMF forecasts that the growth for this year is likely to be -3, the largest contraction since the Great Depression. And for next year, they're forecasting about 4 to 5% positive growth. Personally, and as an economist, I doubt we will recover that fast, that quickly, but that remains to be seen. Other impact of this pandemic is that unemployment is reaching double-digit in many countries. SMEs are going out of business, and even large corporations are facing difficulties managing their cash flow. Inequality are deepening in many countries, and we are unable, as a community, we're unable to meet the needs of the most vulnerable households, including the elderly and vulnerable citizens in many places. So such environment and such circumstances put most, if not all, sustainable development goals at risk. At the country level, policymakers are faced with two hard and contradicting choices. If they don't act immediately and lock down, they risk thousands of deaths from COVID-19. In addition to that, they might overwhelm their healthcare system. Alternatively, if they shut down their economy, they would risk an economic collapse and with a high mortality rate from probably mostly not COVID-19 related reasons, especially in poor places. At the global level, we should, as an international community, learn from previous crises. where global unity and solidarity should be on top of our priorities in times like this. As we highlighted in three T20 statements since early March, we need an urgent investment in critical public services and global public goods to first suppress the virus and minimize the social and economic impact of the pandemic, and also to recover better while maintaining our global connectivity and also the effectiveness of our multilateral institutions. So such actions, if not taken right away, will risk destabilizing many poorer countries and global finances. But if we act immediately as we recommended in our T20 recommendations, this will create the right environment for the international community to assume its responsibilities toward achieving inclusive and sustainable development goals. And we have the co-chairs here with us, and if you remember during December last year, when we were debating the priorities for this task force, we agreed on a number of priorities, which including enhancing the G20 strategies for development cooperation with least developing countries, incentivizing the private sector to support SDGs, improving the G20 capacity to deliver and monitor the UN 2030 Agenda for Sustainable Development, supporting regional development initiative for sustainable and inclusive growth, improving the G20 support for gender equality and economic empowerment of women, and recognizing the importance of universal healthcare system. And the reason I mention these priorities is because we then, in December, recognized that the world is already behind on achieving these goals even before the crisis. And this pandemic should not make us lose sight of our goals. From our part at the T20, we have issued the three statements to the leaders of the G20 before and after their extraordinary summit at the end of March. In these statements, we called for a coordinated stimulus package to allocate resources for businesses, workers, and households, especially in less developing countries. Some of the recommendations that we mentioned in these statements that are also related to this task force include restoring global supply chain, reversing slowdown in global trade, improving access to medical supplies. All of these recommendations will improve global welfare. And in addition, we also recommended reversing the decline in international aid and scaling up cash transfer measures. We also highlighted that there is a serious risk of emerging debt crisis if we do not allow poor countries to immediately suspend debt payments and reassess debt sustainability. As I mentioned earlier, all of these measures, if not taken seriously and immediately, they will threaten to destabilize poor country finances and also global balances. As we observed in early data and also learning from previous crises, especially 2008 and 2009 financial crisis, government and monetary authority must continue to stabilize the global financial market by continuing to inject much needed liquidity. Government must also partner with the private sector, private financial institutions rather, to roll over debt, especially for SMEs and individuals, vulnerable individuals. So we gather today as a think tank community to show that there is an importance for the think tank community contribution to meeting global challenges such as COVID-19. And many of these recommendations have been also highlighted in many of the policy briefs that we have received so far. But within the context of this task force, we should make recommendations, or we should think about and discuss recommendations for policy response that focus on rebuilding better towards sustainable development in several aspects. These should include public and private investments in sustainable development, such as building resilient infrastructure, strengthening social protection system, additional investments in crisis prevention, risk reduction and planning, and eliminating trade barriers and restrictions that affect supply chain. So I encourage you all to actively participate within this webinar and contribute to the T20 process by maintaining our mandate of providing unbiased research-based recommendations to the leaders of the world. While this is the core of our objective as a T20 and a think tank community, I think given the magnitude of this crisis, we should think of beyond giving a policy recommendation. And we may think about suggesting initiatives for the leaders of the G20 to build or rebuild a better world to ensure healthy economic and social and financial well-being for all. To conclude, I would like to say once again that T20 and our partners within the engagement groups under the G20 or even with other international organizations, devoting their time and effort to help the world facing the pandemic. And it is event like this, a webinar like this, bring us together and encourage us to share our expertise. I look forward to working with all of you and also with our partners in G20 and non-G20 countries to expedite the transition to recovery while maintaining the effectiveness of our multilateral system and institutions, and also ensure an effective path towards sustainable and inclusive development goals, which is the core purpose of this task force. Thank you all for your time, and back to you, Jitendra.
Thank you, Dr. Fahd, for your points and highlighting the role of multinational organizations like think tanks in today's world. I'll welcome Dr. Khalid to go ahead with his talk. Dr. Khalid, if you are available.
Yes, thank you.
Your sound is coming a little bit weak.
Okay, is it clear right now?
Yes.
Yes, thank you so much. Good afternoon. My name is Khalid Abdelkarim, the Assistant Deputy Minister for the Primary Healthcare at the Ministry of Health in Saudi Arabia. Today, I'm going to talk to you about the primary healthcare in Saudi Arabia and its role in the healthcare ecosystem and transformation. I will start with a very short brief about the healthcare system in Saudi Arabia. Please, the next slide. So our health system is a universal health care coverage system that covers all the 34 million population we have in Saudi Arabia. 22 million of them are citizens who are covered and eligible for free treatment at all the Ministry of Health facilities. Ministry of Health consider the regulator, payer, and the largest provider at the kingdom. There are other governmental sectors provides healthcare as like the military hospitals and the university hospitals. We also have a private insurance that covers all the expats with a compulsory private insurance that has to be issued for every legal resident. Also, the private health insurance business covers 3 million Saudis who are working at the private sector. Next slide, please. I will talk now about the health transformation plan that we will have in Saudi Arabia. As you know, we have a national plan, the 2030 vision, aiming to improve all services and sectors to have a strong and stable economy and world-class services helping to achieve a good quality of life. So the main outline of the health transformation is to change the current system to a better one to achieve improved population health through a better care at acceptable cost. In this new system, Ministry of Health will act as a regulator only, and all of its healthcare facilities will be transferred to 20 non-profit accountable care organizations geographically distributed over the kingdom that called healthcare clusters. And it will continue serving and providing primary, secondary, and tertiary care services. And each cluster will cover 1 to 2 million population. Next slide, please. It's very important to know about the model of care, the new design of healthcare delivery. It's designed to have different layers and different systems, and it has different interventions and initiatives that helps and going to help to achieve the final picture of our healthcare system. So our model of care will start through activating the person, improving the help-seeking behavior and personal health behaviors. Then we will go for, and we want to have a better health in the community. We'll provide, and we have existed services for virtual care. The next layer is the primary health care, then the general hospital care, and the specialized hospital care, with the different systems of care that covers the wellness, planned care, chronic disease care, urgent care, last phase, and mother and child health. Next slide, please. This is the summary of the 43 interventions. We have cross-cutting interventions, and we have system of care interventions that will work in certain part of the healthcare system to improve and to achieve the transformation. The next slide, please. Currently, at the Ministry of Health, we have 2,300 primary healthcare distributed all over the kingdom. It provides the essential and it acts as a gatekeeper for the healthcare. It provides essential services like mother and child services, vaccinations, urgent care services, and chronic disease management. We are not really satisfied about the current primary healthcare performance and the contribution in the population health. But there are many efforts happened in the previous years to improve the situation of the buildings, the look and feel, and the IT infrastructure. All of these are appreciated and very important, but we are now looking for the primary healthcare from a different perspective. Next slide, please. It's very important to design the primary healthcare around the patient's needs. So according to the model of care, we need to provide all the services at the primary care level related to the urgent care, chronic disease care, palliative and rehabilitative care, mother and child care, planned care, and wellness. We don't want to have one part of the service to overcome the other. We want to provide a full spectrum of services in each primary healthcare center. We can achieve that through, please, the next slide. If we follow the WHO recommendation and the basic primary healthcare functions and components, we need to provide a continuity of care, community outreach programs, coordinated care that achieve patient satisfaction, integration of care throughout all the healthcare systems to have a good effectiveness and efficiency, and again, easy access to the care. If we miss any one of these principles, we wouldn't have at the end a good primary healthcare system. So please, the next slide. We consider all the things related to that, like the IT, governance, staff, equipment, supply, facilities, and buildings are enablers to achieve this, this vision. One of the biggest mistakes we've seen at the primary healthcare that people usually focus on these enablers, and they believe if they have like a strong IT system, they will solve all the primary healthcare problems. We need always to start from the patient's needs. We have to fulfill all the primary healthcare principles and requirements through these enablers. These enablers are important, and you can work around it to provide the basic function that you need. It's a tool, not an ultimate goal. Next slide, please. So our main strategies to provide a full primary healthcare services. And it's gonna be, please, next, by providing the enhanced primary care intervention, which is a part of the model of care. Then, please, provision of the infrastructure, IT, buildings, equipment, and supply. We have now good activities in improving the infrastructure of primary health care and to have a digital solution. The most important and the new thing that we are working on, which is not existed in Saudi Arabia before, it's accountability and patient-centered care. We are planning now, and we already started with pilots, to assign patients to certain healthcare team. So they will have a sustainable, a long time relation that you have your own family physician, you have your own healthcare, you have your coach and nurse. That will be easy to apply through a good governance, a leadership, and training. Please, if we look at the current system, we have scattered primary healthcare systems that each one has a manager and some medical staff. We want to go bigger. We want to create networks within the clusters and to have integrated service throughout the different layers, and to have different teams to help to achieve a team-based activities, patient-centered, and community participation. Okay. Now, just I'll give some information and some data that we encountered during the COVID-19 crisis. We noticed that we had a 30% drop in the primary healthcare visits. There are significant drop in vaccination and drop in chronic disease care. This is going to have a potential risk in near future. Also, we have slowness in our plan and implementation of our development strategies. But not everything happening now is bad. We noticed that we have now increase and speed in virtual solution application. We have improved activities in home care visits, and we could notice an increase number of vaccination and vaccination rate over the last month after implementing these activities. At the end, we are utilizing all the activities, all the available resources to overcome this crisis and to have integrated services with all the healthcare providers and levels. One of the good things that gave us an advantage, the well-distributed primary healthcare helped us now to act as centers for COVID-19 testing and initial management. This is all in brief of what's really related to the primary healthcare in Saudi Arabia. I tried my best to make it concise to deliver the most important information for you. Thank you so much.
Thank you, Dr. Khaled. That was a very insightful look at what Saudi Arabia is planning in terms of its healthcare and how it is proceeding towards meeting its SDG goals in terms of the primary healthcare aspects. Now we will move on to the panel discussion, and for that we have our advisor to the task force, Dr. Addas, who's also the head of Lives and Livelihoods Fund Management Unit at the Islamic Development Bank. Dr. Addas, you can go ahead and
I think Dr. Addas on mute.
Is it, can you hear me now? Hello?
Yes.
Yeah, as I was saying, thank you very much, esteemed panelists and everybody who has joined us for this important webinar. I'm filling for Dr. Sami Swelim, who's the chairman of the task force and who had urgent engagement. And as I mentioned earlier in my modest exchange of email, is to maybe break the ice with some provocative thinking. Although we are in Ramadan, most of us are fasting, but it's just food for thought or feast for thought. The idea basically is that we have enough evidence today that inaction is very, very dangerous. Neglecting SDGs, any one of them, is also very high risk. And as we have seen before in the Ebola endemic and now the COVID-19 pandemic, preparedness is again, yet again, lessons learned. There seems to be one lesson so far learned, is that we hardly learned a single lesson. So with these provocative words, as everybody is aware, the United Nations as a body, there are many organs within that United Nations system, which is the mother of the MDGs and the SDGs now, in terms of design and monitoring. You know, conflict and wars among countries take place from time to time, but the number of people who die from poverty every day, from malnutrition, from hunger, from disease, is way, way higher than those who actually die as a result of conflict. However, we do not have today a system with more teeth equivalent to the Security Council, where it could really make it more binding for countries of the United Nations to really achieve the SDGs. Why I'm saying this as an introduction is because without it, I fear, and of course I don't want to be the speaker here, I'm just moderating, but it's just an introduction. We fear that not much will happen. So without much ado, I've said enough. I would like to introduce the esteemed panelist, Elizabeth, Chief Executive of South Africa Institute of International Affairs, and Dr. Bile Bigasho of Columbia Global Centers for Africa, and also who on the Center of Earth Institute. So Elizabeth and Dr. Bile, you'll take with these provocative questions and take us in the coming 10 minutes each, how we can really refrain from talking a lot about the SDGs, but really to making, through evidence-based, some policy or position paper, not only policy briefs, but as Dr. Fahd mentioned, something more cohesive, a position paper on COVID-19 and post-COVID-19 for the G20 body to take it up and to do something. Otherwise, we'll continue talking until the cows come home. Thank you so much.
Thanks very much, Dr. Waleed. And I see you are using food analogies all the time, including the cows.
Maybe because I'm fasting.
Thanks very much. I think in a quick response to your, I think, much deeper question, and then I'll go into my presentation. Clearly, the fundamental point about the Sustainable Development Goals, which was clear to us even before COVID happened, is that you can't see them in isolation. You can't see them in silos. So you can't see SDG 1, okay, let's tick that box, SDG 2, and so on and so forth. They're all so integrated and interlinked that weaknesses in some areas will invariably impact on the ability to achieve the goals in another. And it's in that context that I want to touch a little bit in my presentation on the issue of governance in the SDGs. Because clearly we know that COVID-19 has the possibility of upending all the SDG commitments because of the requisite drain on resources to combat the health implications of COVID, the macroeconomic and socioeconomic implications of COVID. And so people are sort of responding to what is the most urgent, the emergency. It's also the case that financially ODA was never going to be enough anyway to deal with SDGs. Now perhaps even more constrained or focused in a particular area. And I know that that's also something that Balai will talk about a little later. But fundamentally, I think COVID-19, as indeed Ebola before it in West Africa and the DRC, has highlighted the importance of governance. That this is not just about a health crisis. You have to have in place some of the health dimensions of tackling. But it's also fundamentally a macroeconomic crisis, a socioeconomic crisis, and a political crisis. If you're unable, and this is something that we also learned in Africa and West Africa during Ebola, if you're not able to deal with the health dimensions of it, it very quickly becomes a political and governance crisis. And so we're talking here about a systemic challenge. And of course, and I think this has been mentioned in the remarks made earlier, COVID-19 is also global governance. It has highlighted the deficit in global governance. So what I want to do now is just unpack those a little, each of those a little quickly. So focusing on three levels. Governance fundamentally as an enabler of the SDGs, but firstly, governance is also one of the goals in SDGs as we see it in SDG 16. SDG 16 has 16 targets, but there are also, in fact, 24 other targets and 7 other SDGs that are actually linked to the aspirations set out in SDG 16 around peace, justice, and strong institutions. And so this underpins, I think, the fact that effective and accountable governance is essential in country if we're going to achieve all of the SDGs. And this is irrespective of COVID. I think COVID, as it has done with many other things, has simply accentuated that significantly. So that's the first level. The second level is the governance of SDGs themselves at the global level. The processes by which states are held to account in meeting their obligations. It's also the agreements around how we measure, what we measure. Do we have the correct instruments and processes in place to measure? Clearly, we already see in a number of developing countries, notwithstanding the differences about what we on agreement about how we measure and what the indicators and the targets are for the indices for evaluating SDGs. Irrespective of that, there are also huge data gaps in how we collect statistics in a number of developing economies. And certainly in the African continent, there has been a move to really try to build up statistical capacity. That doesn't take us away from the fact, though, of the overarching system that came into place in 2015, around specifically about SDG 17, where some of the mechanisms and the instruments, the means of implementation continue to be to be fraught. And then the weak governance overall in the global system, that's the third level, which I think we've seen erode over the last couple of decades, not just in the last few years, and which again COVID has revealed starkly. So one of the things I want to touch on now is a survey that was undertaken in Africa, focusing specifically on SDG 16 plus. It was undertaken about 18 months ago or so, and we published its findings around seeing the relevance and importance of SDG 16 plus in the context of what I've laid out. Clearly, measuring governance at a national level is not easy, and certainly the concept is much further behind than how you measure educational outcomes, health outcomes, and so on. It does require a lot of political and technical capacity and leadership in that. But we've also in the African continent have looked at ways of evaluating governance through the African peer review mechanism. I think there is still much to be done there, but I think those are a potential benchmark. Now, what are some of the trends that the survey found, which I think are interesting also in terms of reflecting how important the recognition within African states of the importance of governance in meeting SDGs. Firstly, the political commitment to SDG 16 is high, but the challenge has always been the financial dimension, that we aren't allocating sufficient resources to that. Another trend has been that there is a growing commitment to the targets within that, but specifically looking at SDG 16. In other words, again, the silo approach, but not looking at other peace and governance related targets that have an impact on effective, capable states. Some countries have embraced SDG 16 as a way to reinforce data sovereignty in new domains where this is still a sort of an evolving issue on governance, peace institutions, statistics around that, and how we then make the necessary investments in order to become sovereign, data sovereign in those issues before others come to the table. There have also been efforts within African states to adapt global SDG 16 targets and indicators to the national context. These are growing, but there is still a gap in localizing them. And that's important because you can't take governance systems and simply transplant them from one country to another. So localization is critical. The next point that I want to highlight is the interesting development in some countries in Africa where they're using developing effective accountability mechanisms that are linked to tangible rewards and sanctions that incentivize senior officials in governance-related institutions to deliver on commitments. That's very critical. And lastly then, there is of course a recognition that there is a risk that we're collecting all this data, but do you actually know what you want to do with them? So the issue of data only as important as how you use them in decision-making. So you've got the evidence, but the next step is how you use that evidence in decision-making. Monitoring and evaluation shouldn't be an end in itself. Sometimes it is. Now, what does this mean for the G20? Well, clearly from a development cooperation, ODA perspective, a number of the G20 countries are key actors in that field, and also from a South-South cooperation perspective. And clearly there is a role for that in developing countries in terms of meeting SDGs. They're also key supporters of multilateral development banks. The point here is that both in terms of their bilateral engagements, but also in terms of their engagements in global institutions that also provide development finance and project support, there's the importance of focusing on systems and accountability instruments. African states, as I said, are already recognizing this, but there needs to be a support and incentivization. COVID has, I think, more than anything, highlighted the utility of that. And so it's important that we do not forego the focus on governance and effective accountable institutions. I have two last slides and then I'll keep quiet, Dr. Walid. The one really looks at global SDG processes. The point that I made around the challenge of the architecture that we have created and how effective that architecture is. both in the context of the high-level political forum and, of course, in the remarks that you made around ECOSOC. These relate specifically to the processes. They also relate to the measurements, which I outlined earlier, that these are voluntary, but that we should not think about voluntary national reports as the end game. And in the architecture, that's very much part of it. And that we have highlighted the importance of going beyond that. Pandemics threaten all of us, and the world is as safe as its weakest link. And clearly, listening to the discussions at the World Health Assembly, one is struck by the fact that that point has not been made, hasn't struck home in some cases. And I think it's interesting also as a big idea out there to think about, we have the UN Security Council, as you said, which deals with issues that cover state-to-state conflict, and state-to-state challenges to international peace. Many countries have avoided bringing other transnational security issues to the Security Council. Ironically, the forums that deal with our very survival as a planet and as a species actually have less power. And I would argue that in a less geopolitically fraught world, we should be arguing, and maybe as think tanks, we should be arguing about how one strengthens ECOSOCs and helps to reform and strengthen forums such as the HLPF. These are all important for the G20. And then lastly, in terms of systemic changes, clearly the G20 has a key and important role as a driver of systemic change, if not as a legitimator. And so how we manage and reduce risk is, I think, a key dimension of what the G20 should be focusing on. The importance of working systemically rather than individually, the ability to measure adequacy of response to the risk. And some of the key dimensions in that regard is how do we tackle the fragmented global financial safety net, again highlighted by COVID, and the fact that we need to move to a paradigm shift. We need to have a paradigm shift on how we understand regulations and what regulations are relevant in this world, where we're facing key questions to the financial, economic, and political structure, how we understand debt, I would argue intellectual property rights, and all of those feed into the broader concept of global public goods. Let me leave it there.
Thank you very much, Elizabeth. You've really put a lot of food on the table, and a lot of us, it will take us quite a time to digest so many very, very important ideas, especially on the importance of effective and accountable governance in order to achieve the SDGs. Now, if I may turn to Dr. Pillay and ask him now, as Dr. Fahd has mentioned earlier, with the outlook, economic outlook, going into negative territory 2020 and most likely 2021, and the lost time, we can say, I don't want to say lost decade, but now we have almost a lost year, and already we are behind, Dr. Pillay. Do you think now the financing gap is even worse? And what can we do? What can we do in order to achieve the SDGs by 2030, Doctor, in light of all of these predicaments? Thank you.
Thank you very much again, Dr. Walid, for great, actually, question as a setting stage that you raised. It's extremely important to touch base on those issues. Again, I would like to echo Elizabeth and thanks, the organizers, including our friend Chirendra, who is working relentlessly and enable us to meet this afternoon, your time. The issue that you raised are fundamental. Even prior to Corona case, we analyzed that we are off track. The SDGs are off track. The work that we've done in 2019, a big report 3 years report analyzed that. And in fact, the report was actually how off track is off track, and what are the the best way of compensating the lost time. How do we really catch up with the lost time without also jeopardizing the future? That is the issue that we were discussing. So the off track issue is absolutely admitted at all levels, and regardless of geopolitical variances. Now, on top of that, this pandemic came, and the pandemic definitely worries the situation. The pandemic worries the situation in 2 aspects. One and important aspect is it forces countries to realign priorities and to think like development is second on the agenda. When you have emergency, you got to put your all your heart and your brain on emergencies, including your resource. It's obvious, it's natural, it's organic. But my feeling is we will be beaten twice, we will be defeated twice if we actually shelf SDGs and focus only on emergencies, because our basic cause, root cause for the current emergency, among other things, is our weak institutions, our weak economic situation, our weak priorities, our ill advisors, ill policies in place. So that is the most important thing. And from this perspective, the situation is absolutely very worrisome. And the second important thing is in SDGs, we are pursuing global as well as constitutional issues. 46% of SDGs are global agendas, whether it's climate change or biodiversity or life under water, life above ground. All these things are human rights issues, extracting industries. These are really basic. 46% of the targets are like this, and the rest, education, health, agriculture, these are constitutional, like national and local issues. So in the SDGs financing, in the SDGs implementation effort in the past, one of the things that we keep shouting and yelling everywhere was like, hey guys, we have not started from the same point. Okay, though we have the same targets and the same goals, it doesn't mean that we have the same baselines. There are countries who are completely starting from disadvantages point. There are countries who are struggling actually to meet a balanced budget every year. Now we are asking them to invest on global issues where they have issues that is burning their finger every day on their constitutions. So this issue now, if we don't address it properly, we will be having a big problem on cross-border issues like global issues on of SDGs, and because everybody would be putting everything that he has to actually give priority to local issues. So the whole idea that Elizabeth was talking, SDGs are 17 and 1 at the same time, comprehensive, looking for a maximum package. That is what SDGs. You can't actually take 2 things out and say that you are pursuing SDGs. So that will be in danger. That will be in jeopardy if we don't really move consciously about how to rescue this thing in entire basis. So these are 2 issues. So we just completed a report. I said yesterday to one of you that we were busy on that. So definitely our report is focusing on Africa, and 3 trajectories are happening. And if the situation is arrested, in the coming 2 to 4 months, if the situation goes beyond 4 to 6 months, and then if we have the third wave, the second wave, and what would happen, right? And so we did that analysis. I don't want to go into that report now because it's not yet been published as well, but it will be released very soon. And the likelihood of recovering in 2021 is very unlikely in many situations. So the situation might take us to 2022, provided that how the recovery plan that we have in place is actually contextual and making sense, from macro to micro level perspectives. It's extremely important. And there are some sectors like tourism, hospitalities, and this, that might even be delayed for longer time. And as you know that many economies right now in Africa and even in middle income countries is moving from manufacturing to services, and services would be in trouble. And so I don't want to go into that. This forum may not be adequate for that because within 10 minutes. But this is the situation, and I'm happy to share this in another forum when time is possible. So coming back to SDG financing. SDG financing is like enabler is understatement for finance. SDG financing is a bloodline. Our actually reputation on SDGs very much online, how we would be able to meet our obligation, our commitments, and our promises on SDG financing. The discussion around SDG financing, as you know, Dr. Walid, goes back actually to July 2014, when we have this declaration, IAA Addis Ababa Action Plan, okay, Action Agenda. That was when the discussion started. And there are three important, pillars for SDG financing that have been resolved during that discussion, if you remember. One is increasing domestic resource. Yes, I was also one of the speakers. So one is increasing domestic resource. And the second one is actually the SDG 16, the famous, person agreement, and tapping 0.7% of GNI for OECD countries. And the third one is investment, right? And private sector. So where are we on these three? This is the most important issues. Increasing domestic resource. We are actually asking these countries, as I said earlier, out of actually 37 of low-income countries in Africa right now, almost 80% are under debt stress. And some of them are, just after the COVID now, some countries, they got debt relief for 1 year, okay? We are in that situation. And now we're asking these countries to upfront resources and solve the problem that they have since their creation, okay? Within 15 years. That's exactly what SDGs are, if you want, if you look at it very carefully. If you meet all SDGs, you solve all the problems in the world. So we are asking these countries to put money in that order, okay? Which is, tantamount to impossible. And now the situation is very much exaggerated because even the domestic resource that we are thinking, which is actually mainly 70 to 75% is tax, as you know. And then it comes to duty, this, so we can go to that detail, right? And the majority of the people are now losing their job, their income, and the likelihood of actually meeting that level of thing is absolutely dismal. So that's one. Two, when it comes to the GNI, 0.7% of OECD countries to put their GNI as ODA for developing countries, that actually has all kind of challenges since the beginning. This agenda during MDGs was somehow translated through debt relief. And then some countries, like 6 countries of OECD countries, were met actually that obligation, the rest never. And now the situation is worse during SDGs because one of the country with biggest GNI actually move out from this arrangement in a very significant way, not signing actually the climate agreement, right? And pull off from that. And that actually reduced this thing from 176 billion that at one point was made to back to 146 billion. And when the anticipation is actually to go to 260 billion. So I don't want into that complication, but that is the situation right now. And then the investment, the private investment, because we said that SDGs, unlike MDGs, are investment potential projects. If you invest on SDGs agendas, you have trillions and trillions, investment capacity. If you change all the the engine into electricity, or if you bring the solar system or all these things, these are huge investment capacities. So we were trying to unleash that capacity through this arrangement. And then, the most important thing for investment, even before macro stability, even before other security issues, is such kind of the world stability, and this stability is now in jeopardy. And what will happen under this situation? What kind of FDI that we are expecting under this situation? God knows. And when we are clearing and when we are moving out from this, again, it depends on the recovery plan and also our capacity for making the implementation of recovery plans.
Thank you, Dr. Bilay. If I may just, at least because of the time, I really appreciate how you really decomposed the issue, but just to be a bit more optimistic, can we turn this whole thing in favor of the SDGs?
Yeah, I'm coming to that point. Yeah.
Yeah, since the pandemic COVID-19 started as a local event and turned global, can we now, as a task force, advocate the importance of making sure that the SDGs, although they are local, but they have global consequences if they are neglected?
Right.
So
no, that's absolutely the remaining part of my, I don't know, 3 minutes or something.
Yeah. Yes. Take your time.
So, how do we really? What is the best pathway now? Okay. How do we really live into this and make the SDGs still something performance, right? So here, as I mentioned earlier, on the realignment of priorities, I think we need really to take a very serious stance that we should not actually reprioritize. I mean, we should not actually put SDGs on the shelf. It's extremely important. The second important thing is we need actually to protect the gains that we have obtained in the last 20 years. Okay, during the MDGs and during the SDGs. This is extremely important, whether it is poverty or education or health or climate issues that we have advanced on. This have to be protected. If I have $1 actually, I would put quarter of that $1 to make sure that these gains have been protected. Otherwise, we go back where we were 25 years back. This is extremely important. And the third thing is there are so many initiatives actually popping up prior to Corona when it comes to SDG financing, the PPPs, the blending financing mechanism, how actually, without having the foreign currency capacity, that the local, currency could still be something that can be used to buy, a bond and a stock, that actually funding cross-border issues on top of the domestic issues that countries are struggling on. So that is a new, thinking of blended finance now, because your favorable policy, your macro stability, your all these things would be, counted as a contribution in the blending finance, so that you can attract some other resources as leveraging on this clear and stand economic policies, which is actually we want to push now, which otherwise would not be able to maintain the momentum that we have gathered.
Absolutely.
And the other important thing is we got to go also beyond we want billionaires to contribute. We are having this program, we are pushing this. We are saying that we have 2,207 billionaires in the world with 9.1 trillion net worth, and we want them to contribute 1% of their net worth, which is about 91 billion. All these calculations have been done, and we're pushing. But now, as we talk now, we also have to expand this thing. What about those of us with 1,000 income? Can we really go into some kind of mechanism that where our money will become a billion from billions? Okay, $1 is a billion. Okay, from 100,000, $10 is a million, right? So by the way, I was very much touched with the sukuk concept in Saudi, which is absolutely means a lot on this kind of thing. This is the future. We need really to galvanize support from everyone, and particularly capitalizing on the trust and the partnership that COVID has brought between governments and people, and use that actually to use it, to fund SDGs, to mobilize resources in the future, which is extremely important. So to summarize this, first, SDGs have brought unprecedented level of convergence in our thought, in our vision, in our alignment in the world. This is a rare opportunity. We should not miss it. And we have to put everything to rescue this. This is number one. Number two, this very pandemic has actually enabled us to build this partnership, which was a big issue in the past, particularly in Africa, between governments and people. And we really need to keep that momentum and do the economic recovery, the social recovery, recovering of our prides and confidences, so that we can also leverage this to pull off resources in a bigger way. That is another concrete recommendation that I have. So I will stop here. I know this is something that everyone to discuss, but if there is time during Q&A, I will look into that.
Thank you very much, Dr. Bilay. I'm sure we will come back to you again with a series of questions. We have also Emma Schulz has also joined us. But let me now ask Madame Diana Bennett, OBE, who has enabled many people and organizations all over the world to attain enhanced insight into enterprise, especially the power of creativity, entrepreneurships for more than 30 years, and push the boundaries for our thinking on entrepreneurs. So as they say, necessity is the mother of invention. And with that, we need more creativity, more innovation to get us out of this pandemic. And of course, Jennifer, postdoctoral on Rising Talent Fellow for Early Childhood Research Center in Dublin City University, Associate Researcher for Education Program at the Center of the Implementation of Public Policies for Equity and Growth. So you have 10 minutes each. Please shed more light on the impact of the achievement of the SDGs, if any, and what the G20 can do post-COVID-19. Thank you very much.
Thank you, Dr. Walid. And I'd like to build on the excellent presentations of Elizabeth and Bilay. Look at it from a gendered perspective. So across every sphere, from health to the economy, security to social protection, the impacts of COVID-19 are exacerbated for women and girls simply by virtue of their sex. 2020 is the 25th anniversary of the Beijing Platform for Action and was intended to be groundbreaking for gender equality. But instead, with the pandemic, the limited gains made in the past decades are at risk of being pushed back. This pandemic is deepening pre-existing inequalities, exposing vulnerabilities in social, political, and economic systems, which in turn amplifying the impacts on women. Compounded economic impacts are felt especially by women and girls who are usually learning less and holding more insecure jobs or living close to poverty. While early reports reveal more men are dying as a result of COVID-19, the health of women generally is adversely impacted through the reallocation of resources and priorities, particularly sexual and reproductive health services. Unpaid care work has increased with children out of school, heightened care needs for the elderly, and our overwhelmed health services. As the pandemic deepens, economic and social stress coupled with restricted movement and social isolation measures, gender-based violence has increased exponentially. Women are being forced to lock down at home with their abusers. At the same time, the services there to support survivors are being disrupted or made inaccessible. All of these impacts are further amplified in contexts of fragility, conflict, and emergencies, where social cohesion is already undermined and institutional capacity and services are limited. Gender equality is an enabler and an accelerator for virtually all the SDGs. Gender equality is a goal in its own right with SDG 5, but cuts across all 17 goals and is reflected in 45 targets and 54 gender-specific indicators. This has been well documented, particularly in the UNDP report 2019. A UN policy brief released 5 weeks ago focuses on the issues faced by women and girls and outlines suggested priority measures to accompany both the immediate response and longer-term recovery effects, and I'll refer to those later. COVID-19 is not only a challenge for our global health systems, but it's also a test of our human spirit. Recovery must lead to a more equal world that is more resilient to future crises. And we've already heard mention of institutional memory, and I fear that our institutional memory is pretty bad in many respects. It is crucial that all national responses place women and girls at the centre if they are going to have the necessary impact. This is not about rectifying inequalities, but building a more resilient and just world. It's not merely in the interest of women and girls, but also of boys and men. Women will be the hardest hit by this pandemic, but they will also be the backbone of recovery within communities. And I suggest that every policy response that recognises this will be far more impactful for this. As we've heard in earlier webinars as part of the T20, mainstreaming gender equality is an intrinsic part of the road to recovery from COVID-19. We've seen much research done when we see that women have less decision-making power than men in households or in government, and then women's needs during an epidemic are less likely to be met. Experience from past outbreaks shows the importance of incorporating a gender analysis into the preparedness and response efforts to improve the effectiveness of health interventions, promote gender and health equity goals. Given their frontline interaction with communities, and research says 70% of the health workforce are actually women. Research done in Wuhan in China showed that 93% of healthcare workers were actually women, which goes to show that they're even more exposed and the toll on women is significant. I think you asked about going forward. How do I see the road that lies ahead from a post-COVID world to 2013? Well, the 2030 agenda leaving no one behind, and we have to ensure this. We need to see that gender equality is central to the achievements of all 17 SDGs. Sex disaggregated data is absolutely vital, but it has to be good quality, it has to be measured, it has to be used for robust monitoring and also establishing trends across a range of different indicators. I think setting an agenda for strengthening accountability for gender equality commitments at global, regional and national level. Every policy response that recognises this will be the more impactful for it. To achieve this, and I will quote from the UN policy brief that I mentioned, there are 3 cross-cutting priorities. Ensure that women's equal representation in all COVID-19 response planning and decision-making. Evidence across sectors, including economic planning and emergency response, demonstrates unquestioningly that policies that do not consult women or include them in decision making are simply less effective and indeed can even do more harm. Beyond individual women, women's organisations who are often on the front line of response in communities should also be represented and supported. 2, drive transformative change for equality by addressing the care economy, both paid and unpaid. In the formal economy, care jobs from teachers to nurses are underpaid in relation to other sectors. In the home, we see women perform the bulk of care work, unpaid and invisible. Both are foundational to daily life and the economy, but premised on and entrenched gender norms and inequalities. It's funny, people keep saying everything's come to a standstill. They haven't. There's a lot of invisible work continue to going on in terms of care, cooking, caring. Thirdly, target women and girls in all efforts to address the socio-economic impact of COVID-19. It will be important to apply an intentional gender lens to the design of fiscal stimulus packages and social assistance programs to achieve equality and opportunities and social protection. And I think these 3 cross-cutting priorities reflect the Secretary General's recent call to action on human rights, which singled out measures that, if pursued, would actually have meaningful impact on the rights of women and girls. So, in conclusion, I'll say it again, mainstreaming gender equality is an intrinsic part on the road to recovery from COVID-19 and in achieving the Sustainable Development Goals. I'd like to think that I've put that across there. Thank you.
Thank you very much, Dana. You put it again so nicely, and very important, mainstreaming gender. I don't want to talk, because if I start talking about gender myself, it will take hours and hours and hours. It's such an important subject that, you know, in terms of the fighting poverty, women play a much bigger role in fighting poverty worldwide. So without much ado, we'll come back to you, Diana. Jennifer, if you please now complement what Diana has mentioned and the importance of early childhood. Thank you.
Thank you, Dr. Walid, for the presentation and for the moderation of this panel. And thank you, Jitendra, for all the work of putting this webinar together. It's such a good opportunity to meet each other in these very strange circumstances. So I will talk about early childhood, and I will refer to early childhood as a systemic challenge that has been made rather invisible by the COVID-19 pandemic. And I guess it's very good that my presentation is at the end of the panel, because I will echo my colleagues, because early childhood is definitely linked to governance, is linked to health, to gender, and to finance in a way. But first, let me tell you that my presentation is based on a group work, and the group we've been working with, led by Professor Matthias Urban, and with colleagues from Europe, Southeast Asia, and South America, where I'm from. Since 2019, we've been working in early childhood and developing a series of policy briefs where we've been challenging and tackling this very important and central issue for SDGs and certainly for a post-COVID-19 world. So, as you know, probably there is a broad global consensus and a solid body of research that points out that early childhood programs, provided that they are of high quality, are beneficial to individual children, but also to their families, to communities. And the evidence also shows and points out that the way in which we as adults in a society receive the new generations in the world impacts in many other dimensions. It impacts on gender equality, on social cohesion, on economic growth, and certainly on our global well-being. The recognition of early childhood within SDGs underlines definitely such a consensus, and as we read in Target 2 of SDG 4, we want to ensure that all children have access to quality early childhood development, education, and care. But Despite of this, in a way, silo way of looking at early childhood, I think EC, early childhood, is transsectoral, and it goes beyond the SDG 4. It actually, there is an argument that could be made that EC is an enabler and accelerator to achieving all SDGs probably, and to explore also their integrated and interlinked nature. So integrated policies that focus on early childhood include all sectors, include at least health, sanitation, nutrition, education, social protection, and are key to achieving at least 7 of all SDGs on poverty, hunger, health, education, care, water, and inequality, of course. Because early learning and care is embedded in children's holistic development and comprises physical, emotional, cognitive, social, and cultural and spiritual aspects from birth. The upbringing of young children defies our silo mentality and our sectoral tradition of designing and implementing policies. And in a way, this COVID-19 crisis has shown just that. What our limitations are in terms of designing more cohesive and coherent policies for young children. But also, I think in this current pandemic, in a way, we have focused a lot on the population that is most at risk from a medical standpoint, which is mainly the elderly, of course, and the immunosuppressed and other groups at risk. But we seem to have forgotten that at the same time, the most vulnerable population from a socio-economic and educational point of view are still young children and their families. Young children and their families are most likely to be living in poverty than adults, and that happens in all regions, in all global regions in the world. And they are also more vulnerable to its effects, to the effects of poverty and to the effects of inequality. And that is not less true in this context of crisis. Actually, it's probably more true because as we know, the pandemic context has compounded existing inequalities, and it is likely to create new sources of inequalities, not least due to the unequal access to vital public services, of course. And I want to echo and highlight what has been pointed out by a number of academics and also international organizations to saying and highlighting that young children are at risk of becoming the invisible and silent victims and sufferers of this current pandemic. And that has got to do with their situation in terms of poverty and inequality, but also has to do with the fact that our EC services have been dramatically impacted by the current pandemic crisis. First of all, because unlike other services such as, I don't know, primary or even maybe secondary schooling, early childhood cannot be at least fully provided online. So there is an urgency to support this vital service and public infrastructure during the crisis and make it a long-term priority as well. But second of all, because in a way the pandemic has unveiled weaknesses in our social systems and in our early childhood systems that were already there. In a way, it has accentuated what we have been noticing in many parts of the world, and in a way we cannot ignore it anymore. The fragmented nature of early childhood services and sometimes the market-oriented nature of EC services, especially those oriented to very young children, has proved unable to respond to the challenges of the crisis. And in a way, these traditional theories and practices that place early childhood in a disciplinary and policy silo are proving very problematic and disregard in a way the contribution of early childhood for the immediate and complete functioning of society. On top of that, we know now that the disruption of early childhood services in the pandemic has a wider impact. All of you that have children know what I mean by this. But yes, the so-called childcare crisis in a way impacts on children, yes, but also on women, on families, on the economy, and on society as a whole. Early childhood is a vital piece and will be a vital piece not only to build a more just and equitable world, but also to reactivate the economy and move towards a post-COVID-19 world. So, in a way, how do I see the road that lies ahead of us? So what we see and what I see is we need definitely a paradigm shift. We need to leave behind the silo mentality with which we approach early childhood, and not only early childhood, as we have heard in previous presentations, but I guess it impacts very negatively in the way we design and implement policy for these for younger children, and move towards integrated systems that can support young children's holistic rights and needs. But I guess it's not only integrated, and that's what we had been saying maybe prior to the crisis, but I would like to add, we also need resilient systems. And that's probably something that we have realized or maybe started to highlight now with the current pandemic. We need systems and services that are not disrupted by, let's say, pandemics, but any other crisis that lies ahead. We now know that the next crisis is just around the corner. We cannot ignore that this or any other thing will happen again, and we need ways of supporting young children and their families. That's why we need to build these resilient systems. So in order to prevent children from becoming the silent victims of this pandemic and to build also a more just and equitable society, I guess what we need to move forward now is to build a roadmap that takes us from this very moment to 2030 and puts children in the center of the discussion. We need, of course, to fundamentally reimagine services. We cannot continue as we are. We cannot continue with this silo mentality, with fragmentation, segmenting services according to different groups of the population. And so I guess to do that, there are a few ideas I want to share and to put under discussion for the Q&A later, maybe. So I guess we need, first of all, to understand the holistic nature of early childhood development. Early childhood is not pre-primary 1 year before primary school. Early childhood involves everything that happens from birth until children start, or even the first years of primary school. And
even before birth, I'm informed, even while pregnancy,
exactly.
It's important to educate while in the womb.
No, exactly, and support pregnant women in the development of young children, and in a way build that system we need to receive the new generations in the world. And another thing we need definitely is intersectional approaches to governance. Silo perspectives are not useful anymore. And to protect children and their families, we need anti-cyclic or anti-crisis funding sources that are protected, that are not disrupted every time there is a bump in the road. We also need democratic debate in terms of how to approach universal but culturally appropriate services for all children that are at the same time, in a way, pertinent but for everyone. And finally, we need monitoring evaluation that can ensure that, in a way, at the local level, we have the best quality services possible. So I'll stop there. Thank you.
Thank you very much, Jennifer. And also, you are exactly on time with Diana. So we almost have another half an hour for Dr. Hanan and M. And really appreciate your work on early childhood. It triggered some ideas while you were talking, is that the SDGs, since we are on the road to SDGs altogether, there are very immediate actions to be taken for the SDGs post-COVID. There is medium term and there's the long-term investment, because early childhood the fruits of all of this investment will come many years after. So what we do now with the early childhood and education will reap the fruits much, much later. So it gave me this idea whether we can unpack the whole SDGs into what we can do now, post-COVID, immediately, and what needs to be done now in order to reap it after the short term and then the long term. So thank you very much once again, all of you speakers, Elizabeth, Dr. Ville, Diana, and Jennifer. And now, Jitendra, I pass it to you if you have any questions for the panelists, or would we now invite Dr. Hanan and Emma to comment on what has been said?
Thank you, Dr. Adas, and thank you to the panel. Really interesting questions that were posed over there. We still have some time for our three interjections from Dr. Ime, Dr. Hanan, and Dr. Arora, and then we can squeeze into the question and answer sessions. There are a few questions which have come up, so we can answer those at that time. We still have quite a lot of time left, so let's go ahead and listen to Dr. Ime.
Yeah. Okay, Ime.
All right.
Is Dr. Hanan with us? Yeah.
Yes, she's going to speak after this.
Okay, great.
Yes, I'm here.
Ime, please.
Yeah, thank you. Thank you, Dr. Walid, and thank you, Jitendra, for organizing this webinar. And it's very nice to see you all again, many of you, and to have a space to share our thinking and our proposals. So it was very interesting listening to the presentations. And when in our authors group, when we thought, what can we propose to the G20 as G20 to accelerate action on SDGs in their own territories, but also globally? Because this is the question which remains in the room. Yeah, we can make our points and say why gender mainstreaming is important, why SDG financing is important, but what should the G20 as such do? And what in our policy brief, which is nearly ready, Jitendra, so you can publish it tomorrow if you want, I think. And I want to make you curious to read it. We looked at the main challenges and the main competitive advantages the G20 brings across for supporting the SDGs and for understanding how determined action in the G20 can help to reduce G20's vulnerabilities, which have been shown very clearly by COVID-19, also very strongly in Europe, very strongly in the US. We think that the main characteristic of this 2030 agenda is the interconnections between these 17 SDGs. If you do not address the interconnections, and you have made that point with the mainstreaming and with showing, for example, the importance of early childhood care, if you do not address the interconnections, then you fail with the 2030 agenda. And that is important because interconnections is the opposite of how we usually organize public policies and public administrations. They are organized in separate fields. They do not interconnect so much. So we looked for concepts to educate us for addressing these interconnections, and we discovered the Global Sustainable Development Report, which was published last year, which proposes to organize these interconnectedness around 6 entry points, and the first one is human well-being. It includes also climate change. It includes the global commons. It includes economic action. But to organize these 17 SDGs and their interconnected is around 6 entry points and 4 levels of action. And these 4 levels of action include governance, economy, science and technology, and individual and collective action. And in our policy brief, we compared that with the way the G20 works. And we saw that the G20 has competitive advantages when it acts in the field of economic and financial policy. That's where there is strongest agreement. That's what G20 countries want to focus on. And if it is done in the right way, you can have economic policy action which supports implementation across all entry points, across all SDG fields. So what we propose is that the G20 should relaunch its action plan and restructure its action across these entry points and across and focusing on economy and science and technology. Why science and technology? G20 is weak on that, but we know that engaging in transformation is extremely knowledge intensive. Yeah. The last meeting of the Science and Technology Working Group of the G20 was in 2016. So we propose to establish a permanent working group on science and technology. The report the OECD prepared for the G20 in 2016 showed that the amount of funding which public budgets foresee for science and technology is much too low. It varies between 0.1 of GDP to 4.5, that's in South Korea. 0.1, I think, is Saudi Arabia also, but also Argentina has a very low level. So there is a lot of room for improvement. And what we also think, what is very clear, is that we still have this separation of the Sherpa track and the finance track. So the interconnectedness of work streams in the G20 is not addressed. Yeah. So we think that there needs to be established a dedicated joint structure between the Sherpa track and the economic or the finance track for oversight and steering, so that SDG relevance is at the core of G20 action in all its work streams. So we are not saying change the work streams, we say improve the coordination and the connection between them. Invest more in science, and make sure, that is the fourth proposal, that recovery and economic stimulus programs after the Corona crisis contribute to the implementation of the 2030 agenda and make it sustainable that way. Yeah. So explore the potential of interconnectedness and explore it where in those areas where the G20 is strong. And make sure that economic and financial policies are not seen as separate from sustainable development, but as strategic levers to enhance action, to accelerate action, and to make sure that sustainability is at the core of government and public action. Because the difficulties which were described by Belay, we face the same difficulties at a different level, but we face similar difficulties in Germany in the sense that we have to make sure now that sustainability is not postponed, but that it is seen as an essential part of reacting to the crisis, to the Corona crisis.
Absolutely.
And attacking and reducing the vulnerabilities which we are now clearly exposed in all our societies.
Exactly.
And support those countries and societies which have less resources to act now. Thank you.
Thank you, Emma, very much. Really, you echoed again what we've been saying, that this is an opportunity now for everybody to consider what happens in one locality has an effect on the whole global unprecedented situation, and that this development is a serious business. It is really a very serious business because it affects lives of many people, thousands and thousands of people. Thank you very much. Dr. Hanan, خير الختام المسك زي ما بيقولوا. Last but not least, the floor is yours, Dr. Hanan.
Your mic.
Hello?
Yeah, sorry. Good afternoon, everyone. It's very nice to be here with you. Can you hear me now?
Yes.
Okay. It's very nice to be back here again with all of you. Seeing all of you safe and well. I hope you remain safe and well, and your loved ones.
Yeah.
our policy brief, I was honored to participate in this policy brief with a group of colleagues, Dr. Ahmed Al-Amri, John T. Rowland, and Hussein Rika, and we chose the subject of universal health coverage. The title is Accelerating Progress Towards Universal Health Coverage. We believe that universal health coverage will solve a lot of the problems that we see in the health systems today, and even it will reflect and it will have consequences and impact on the social and economic issues status as well. As we can see now with the corona pandemic, how much devastation around the world economically and socially, and even the education system. So health is at the core of the economy. And also universal health coverage would ensure to eliminate the disparities between different segments of the population, the elderly, the handicapped, the poor, the migrant workers, the refugees, the migrant communities. So universal health coverage is essential, and it is proven by the corona pandemic that it is lacking around the world. Wealthy and poor countries alike. A few countries have success stories, but still, regardless, it is the whole world is suffering with a lack of access to healthcare. We believe that universal health coverage is not about financing healthcare. It's about much more. It includes all the features of the health system, including quality of care, including use of innovation, including workforce characteristics, and governance and legislation. That's why when Elizabeth was talking, it was music to my ears. As we, of course, when we started, Corona was not on the scene, but the Corona pandemic really raised many questions about the core values of health systems around the world, and made us really learn a lot of lessons. So we tried to incorporate as many lessons as we could in our policy brief. We identified 4 challenges. The financial system sustainability, of course, as we all know, is at the center of the dilemma for universal health coverage. And of course, as Jennifer was saying, the silo models, the fragmented models also are there in healthcare. And the lack of focus on primary healthcare, although we give a lot of lip service and a lot of talk about the importance of primary healthcare, however, little is done on the ground. The health workforce is essential. Sustainable and versatile health workforce is a problem to all communities, all world communities, the rich and the middle income and poor communities as well. So these are the 4 challenges. The 4th challenge is the limited utilization of innovation and technology. And of course, we've seen the impact of use of innovation and technology all around the world, starting from China all the way to here in Saudi Arabia. Technology has been in the center of providing better access to healthcare around the world. So these are the 4 challenges. I will spend the rest of the time just talking about the solutions or the proposals that we are proposing to address all the 4 challenges. There are 4 areas that we focused on. The first, of course, is financing. And we think that all healthcare systems, the wealthy and the poor alike, they need to develop alternative models of healthcare financing. Most of all is to accelerate or to gain the political commitment. We need politically sustainable funding to healthcare services, and we need communities to view healthcare as spending as an investment in the well-being of society, as well as the economic and social prosperity. Fiscally sustainable, and it should be also most important regarding financing is the fact that efficiency in healthcare spending is not there. So we need to utilize evidence-based health benefit packages, engaging the private sector and private-public partnerships. And in terms of the new models of healthcare, of course, we want to bring back primary healthcare to the center, and we want it to be integrated in a value-based healthcare system that is more effective in delivering health outcomes. And there are many examples around the world. We also provided some. How is my time, Dr. Waleed?
Well, a few minutes, yeah.
Okay, good. Because I felt I was running
No, it's
short.
okay. No.
So there are many alternatives or many ideas regarding the models of care. And we are proposing that we need to also innovate in the way that we deliver healthcare services, incorporating more technology as well as new models of healthcare delivery. In terms of the versatile workforce, we are proposing two angles of solutions. One, on the country level, many countries are not investing enough in healthcare workforce development, and they have many issues regarding licensing and governance, and also the utilization of these health workers. So, for example, studies show that nurses and doctors oftentimes are performing tasks they are overqualified to perform. The other angle is more collaboration and more cooperation among G20 countries. In the G20 countries, there are some of the world's largest exporters and importers of healthcare professionals. So they really need to get together and to find solutions to avoid the drain, the brain drain in some countries, and also to provide sufficient supply to the other countries. So we need to have more co-investment in healthcare education, in joint ventures between G20 countries to resolve this shortage that is expected to be 20% by 2030 of the needed of the total workforce. So we will have a huge shortage. In terms of utilization of technology, as I said, during this pandemic, we have been using and seeing the drones, and we're seeing the remote consultation, the mobile data and public tracking of patients and contacts. So we need to really capitalize on that. We don't need to have a pandemic to motivate us to use the technology in the most efficient way. And we need, again, to look beyond innovation in technology towards innovation in the way we do things and the way we provide our health services. We need to enable regulations around privacy and safety and ethics of innovation and ethics of using of technology. I think during this crisis, we have seen many issues that of concern in this regard, especially the intellectual property rights and ensuring access to the whole world community, the whole population, to proper medication, effective medication, the proper testing, the ventilators, the immunizations. We're seeing this is there's sort of a war between different businesses or pharmaceutical companies, and there's an ethical dilemma there that G20 countries must really resolve to assure access to the world population to the latest evidence-based healthcare solutions. I think this is an important issue that has been raised by this dilemma. Of course, we need to have, when we talk about universal health coverage, people think that we are talking about more government involvement. Of course, during the COVID-19 pandemic, all governments were involved up to their heads in the providing of services. So I think we need to bring more involvement by governments into healthcare services. However, the private sector needs to be still partner in certain areas of in a way that does not eliminate access, but rather increase health coverage to everyone. And we need to align the research findings with the industry and the private sector. I would stop at that because we have a lot to say.
Thank you very much, Dr. Hanan. Really, you have such a rich and very timely paper with the team. So really appreciate your comments and presentation here. So Jitendra, we have almost 10 minutes left. So do we take another round of questions, or
So Dr. Adas, I was thinking that Dr. Arora can finish her submission in a short period, and there's one question which has come up, so we can answer that, and then I can go into the closing.
Okay, thank you.
Dr. Arora, the floor is yours.
Thank you very much, Jitendra, and thank you very much to all the panelists. It's been fantastic to hear from you. I think coming from a very urban transport kind of perspective, I do want to make this submission
to the panel that the playground for implementing SDGs are the cities. The people are in the cities and the issues are in the cities. It's very important that we focus also on how are we going to create cities which implement the SDGs by design. When we talk of equality, when we talk of empowerment of women, can women walk to the bus stop? Can children go to the schools on their own? Do we have access to safe healthcare? Can we pay for transportation to that place? There are a lot of city-specific design issues that are worth looking at from the SDG perspective. I could elaborate on it, but we'll keep it for another time. But I just wanted to bring that perspective that SDGs is beyond programs and policies. We need to look at SDGs by design in the city. So with that, I want to hand over to you, Jitendra. I know you need to take another question.
Thank you.
Thank you so much. So I have two questions, so we can answer both. We still have quite a lot of time. So the first one is from Dr. Saha from RIS New Delhi, who asks impressions of the panel on key means of implementation of the SDGs during COVID and thereafter, with a specific focus on finance and technology. So anybody can, from the panel can take that.
Emma, yeah?
Yeah, I think it's good to distinguish what is needed as an immediate response to the corona crisis and how the midterm and how to address the midterm response when you want to improve structural weaknesses, to address these in a way that they also contribute at the same time to SDG implementation. So, and I think especially when we look at the emergency reactions or the relief actions, it's important that we conceive them in a way that they mitigate vulnerabilities, especially help those parts of the population that are especially vulnerable and affected. And here I do not speak only of the sickness effects, but the economic and social impacts of the lockdown. I mean, this is very clear that this has large effects. And regarding technology, I think it is most important to join forces, also funding for developing vaccines, for developing treatment, and for making it accessible universally. That we have seen when the sickness hit, that the globe is affected at its weakest parts, and the weakest parts at the moment are in the north. This is important to note. Also, the north has a lot of resources to solve these problems by itself, but it needs to adopt a universal perspective regarding the distribution and accessibility of vaccines and treatment. And that is a matter of finance as well, and of multilateral cooperation.
Thank you, May. The second question is from Dr. Mohammad Nurunabi, who asks regarding the implementation of SDG and the impact of healthcare corruption, the GDP share on healthcare. It shows quite a lot of disparity globally. So again, it's up to the panel. Anybody can pick that.
I can come in on this.
Sure, go ahead, Billy.
Right. Yeah, I think this is very important. We've seen that countries with, the highest GDP and also highest GDP, share for the health budget are equally struggling during this kind of pandemic, right? And if you compare the US per capita health budget right now, is close to $8,000. And we are struggling actually to secure 86 to $110 per capita for Africa. So just compare this. And we both are actually struggling and do not have instant solution for such kind of emergencies. So the point here is, I think it is there is something actually missed out. The efficiency for the health system is first, it's not different from all other efficiencies in economy. That's true. But when it comes to focus, we believe that still, as a global goods, the public expenditure has to have an important role to play on health protection system. This is not something that you leave completely for market, and the market failed us repeatedly. So the health system is very important because it's a global good. It's a global common. You cannot protect yourself alone as a nation. Even if you are almighty, you are still interconnected. So there is no way that you will be able to secure your own thing without actually having that kind of investments. So I think it is time actually to fix this broken situation. The world cannot afford, another, emergency of this level. Perhaps, this unfortunate thing has to be, dealt with for once in time, using this opportunity as an important thing. And for this, the only important solution right now is universal healthcare. UHC is not only about health capacity, health efficiency, health prevention. It is also about health financing, and it's also about health transparency, accountability, and it's also about letting people to come forward and do their health system, protection and medication without feeling the burden of finance. So this is extremely important. If we have that kind of system, we will be able actually to solve half of the problem now.
Thank you, Bilay. I'll close that. We are almost at the end, so I'll just give the task force update in terms of the policy briefs. What's the current status? So overall, we had received almost 58 plus abstracts that were submitted. From there, we had 10 abstracts which were accepted. We received one from another task force, which was more in tune with what our task force was aligned with. And one more was submitted by our lead co-chair, Dr. Sami, who couldn't attend today's webinar because of another conflicting arrangement in his organization. And so we came to 11 overall, because we had to transfer one policy brief, which was an excellent policy brief, but we had to transfer it to another task force because it made a better fit in that particular task force. So right now we have 11 policy briefs, which have almost all of them, save a few, have gone through the process of peer review. And they have, the peer review comments have been communicated to the authors. A couple of them are still pending. So the peer review process was that we had the policy briefs peer reviewed once by members of the task force and another time by the co-chair, and then it went to the policy and research committee of the T20 secretariat, where again it was reviewed twice. So we have had 4 reviews of each policy brief. Some have been reviewed externally also by expert reviewers who have commented on them. And those consolidated reviews have been then communicated back to the authors. So as of now, this is the timeline that we are standing at. We have received the comments. Some of them have been communicated already to the authors. A few are still pending. We hope that they are completed very shortly. On the June 15th to 17th, we'll have a virtual webinar series, which will be focused more on discussion of the recommendations of the policy brief. So it's going to be organized over 3 days with the authors attending. This is going to be primarily for the authors of the policy briefs. It's going to be again a virtual web-based webinar come conference. That's what we are trying to do. And we hope to receive the final policy briefs by the 30th of July. And post that, we'll have the communique in September, and then the summit will be, the T20 summit will be on the 31st of October to the 1st of November. And after that is the G20 summit. So hopefully we should be able to adhere to the timelines and we should be good to go. And it's almost 3 p.m. So thank you everybody for your time. I'm really appreciative of everybody putting in their time. The discussions were really good, and thank you so much for all your time. Really, thank you so much.
Thank you, Jiten.
Thank you. If I can request the panelists to stay back for a screenshot photo, I think that's the new selfie. Ready? Here we go. Say cheese.
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 Thank you so much, sir. Thank you.
Thank you. All the best.
Thank you so much.
كل عام وانتم بخير. Happy Eid to all. Thank you.
Thank you.
Thank you.
All the best for the end of Ramadan.
Yes.
Great week.
Thank you very much. See you.
شكرا.